Hello, and welcome to the first episode of our Network Voices conversation. In this series, we actually pair members of the Marathon of Hope Cancer Centers Network Patient Working Group with network administrators, researchers, and clinicians so that we can learn more about what this pan-Canadian initiative is about and the impact that it can have on cancer patients. But before I introduce today's guests, I think it probably makes sense to introduce ourselves. My name is Natalie Kwadrans, and I'm based here in Calgary, Alberta. I've been a cancer patient for about 5 years, diagnosed in 2019, just 5 days after my 46th birthday, and I was diagnosed with stage 4 breast cancer. To this day, I am receiving palliative treatments just to extend my life, so very thankful those exist. I became involved with the Terry Fox Foundation before my cancer diagnosis, and it was actually through my kids' school, which hosts an annual run to raise money for cancer research. And it was through the foundation that I heard about the Marathon of Hope Cancer Center networks, which you may also hear being referred to as the Marathon of Hope Network or even the MOHCCN. So I just thought I'd introduce those terms in case you hear them. And at that point, I did see a call out for the group, for patients, I mean, to join the patients working group. And that's how I got here. So using my story and lived experience, what my hope is to move the needle forward so that we get earlier screening, better treatments, and hopefully down the road, a cancer-free future for my kids and for the generations that follow. But that's enough about me. I'm not your only host here today, and I am joined by Kathy. So Kathy, would you like to introduce yourself?
Thank you, Natalie. I'm Kathy Smith from Thunder Bay, Ontario. I'm a patient engaged in research because I believe research moves science forward. In fact, it's probably the only way that science moves forward, and I want to contribute to advancing that cutting edge for the betterment of all. As well, I believe I altered the outcome of my dismal prognosis with stage 3C cancer. Given less than 50-50 odds of making it for 5 years, I'm now at 20. And I believe that's because I agreed to take part in a clinical trial. Recently, when my husband was facing an aggressive chemo regime for a very rare blood cancer, I searched online for an open clinical trial. I found one. Further tests were performed at a large cancer research hospital to determine his eligibility for the trial. Results revealed a complete change in diagnosis. How many times can somebody say, these tests reveal you don't have cancer? What an amazing result. Anyway, not only that, there was no need for the systemic treatment. And these positive research experiences, coupled with my experience as a background as an aquatic toxicology researcher and an educator, they power my passion as a patient engaged in research, or a PER. I serve as a research study coordinator, co-author, early researcher mentor, and a research and awards reviewer for a variety of healthcare organizations, including the Ministry of Health and the Marathon of Hope, CCN, Cancer Care Network, the Terry Fox Research Institute, and the Canadian Cancer Society.
Wow, that's amazing. Thanks for that, Kathy. I know Kathy and I are really excited to host our first ever Network Voices conversation with you. So today we'll be talking with Dr. Isabel Serrano, the Managing Director of the Marathon of Hope Cancer Centers Network. Dr. Serrano holds a PhD in pharmacy from the University of Alcalá in Spain. She has extensive experience in cancer research. She was working as a postdoctoral fellow at the BC Research Center and the Genome Science Center in Vancouver. And she was in molecular biology and cancer cell signaling field. In 2021, she joined the Terry Fox Research Institute, or the TFRI as we call it, as a project manager for the Marathon of Hope Cancer Centers Network. And at the beginning of this year, 2024, she was appointed the managing director for the program. And with that, and before passing the baton to Kathy to kick it off, we first want to bring in Isabel to the conversation, and welcome, Isabel.
Thank you so much, Natalie. Thank you, Kathy. Thank you for that kind introduction. And it's my pleasure to be here today.
Thank you, Isabel. And can you tell us, Isabel, what exactly is the Marathon of Hope? What is that?
Yeah, so the Marathon of Hope, I think everyone can know these words by the run of Terry Fox. That is the Marathon of Hope. It's the run across the country and his mission to create awareness about cancer research. And the legacy of this program is that we are creating a Marathon of Hope Cancer Centers network, meaning that we are uniting all cancer research centers across the country, the same as he did with his run, to make a difference in precision medicine. And I can get into more of the detail of what that means. But basically, we have today 34 institutions joining this network, and we are continue growing. And we just continue seeing how all the researchers and the oncologists, patients, administrators at the hospitals are getting together in what we call the Team Canada of Cancer Research to advance precision medicine. And to create all of them together, they are creating a data set, what we call the gold cohort. And that is what will, the tool that will be really what will create a difference in precision medicine.
Thank you very much. So it sounds like this is a network of networks. Would I be accurate in saying that?
Correct. Yeah. How the network is structured, it's is with different consortia. That's what we call. There are regional consortia. Those are in the different provinces across the country, and we have now a pan-Canadian network, and we call it that way because it's from coast to coast. So we have all 10 provinces represented. As I mentioned, we have 34 institutions. And what we are hoping as well is continue growing and making more of a coast to coast to coast. So bringing as well northern territories into the network and continued expansion. But it is absolutely an effort that is coming from the regional provinces towards a national initiative.
Perfect. What impact can the Marathon of Hope Cancer Centers Network have on the lives of the cancer patients?
Well, the impact is mostly the reason of being a pan-Canadian network and bringing everyone together. So the idea of making a difference in precision medicine, it's about having everyone working together. We need all the brightest minds across the country to get together to develop the policies, the recommendations, and the guidelines to operate this network. And that is happening already. Now, what we need is, as I was mentioning earlier, what we call the gold cohort. So what is that? That is a data set that is composed from the clinical information of the patients and the genomic profiles of their tumors. So with that data set, what we are going to create is an instrument that clinicians will be able to interrogate, to be able to change how we are treating patients in the future. And we know that not two tumors and not two cancer patients can be treated the same. And we need to understand the learnings from that to be able to tailor the therapies for tomorrow. So it's good to think about the Marathon of Hope as not like a cancer care of today, but the cancer care of tomorrow. And it's really about what we are doing today by putting all this information together, how that will contribute in the future. There's a very good example that one of our scientists uses, and it's about comparing the Marathon of Hope to, in terms of art, to the pointillism. So you know how if you have one of those ceramic paintings and it's all about dots. So if you have one dot, doesn't really mean much. To have 10 dots doesn't really mean much, even hundreds. But when you start to put in thousands and thousands of points together, then you start seeing that pattern and that picture. The Marathon of Hope Cancer Centers Network is that picture. So that is what we need to get all of the information of all these patients get together to be able to have the tool to interrogate using artificial intelligence and other technologies to be able to get answers on how we treat better a patient. So, you know, when in the future, my patient will get into clinic and will say, the oncologist will see has a bladder cancer and has a certain characteristics. The individual will be a unique environment to that tumor. So now with all that taken together, if that tumor gets sequenced and analyzed, can they compare it and interrogate with the Marathon of Hope Cancer Centers Network research and understand what will be the best treatment for that patient? It may not be chemotherapy, it might not be one drug, it may be a combination of several. So it's really understanding that power, what will become, a better, at the end, a better outcome for that patient and better treatment, better diagnosis. And that is the hope that can be achieved with this initiative.
And I think we're all hoping that precision medicine is going to really move that dial a lot further along for the betterment of all cancer patients. So my last question for you is, how exactly can you bring precision medicine to more and more cancer patients?
That's an excellent question, Kari, and not very easy to answer, but where we are today, I mean, it's been a good ramp up in the last couple of years, and it's, as I mentioned earlier, 34 institutions. The data set right now counts, and it's very exciting. This month, we just got over the 4,000 patients profiled, and the objective is that we will have 15,000 by 2026. So it's really getting momentum, and it's really getting a lot of engagement. And this is the year, I believe, that we need everyone to feel that they are part of this. As I mentioned, it's the Team Canada Cancer Research. It's about the patients, it's about the oncologists, the researchers, but it's about all the Canadians, because this program is funded through Health Canada, through the government, and is with the dollars of every Canadian. So I think it's very important that we can feel that type of ownership when we hear about this program, that everyone can feel that can contribute to it, and also that it can serve everyone in the future. How important is that? So we want to, no matter where you live in Canada, be able to benefit from it. And nobody, I mean, who doesn't know someone that has cancer or is living with cancer, is battling cancer, we have lost someone to cancer, or we may get one day cancer. This is important to all of us. So I think it's what we need to do today is create more awareness as well about this initiative, and be able to bring all other underrepresented communities as well. We know historically how research benefits more certain communities, and what we need to make an effort, as as Terry said with his run, that every Canadian should be part of it, and every Canadian should give $1, right? And I think he made that happen, and I think we should be inspired by that and continue trying that with this Marathon of Hope Cancer Centers Network, and make it a tool that can benefit everyone equally. So for now, at the beginning, I think it's a phase step, and the most important is that we start with engagement, with explaining what this is about, and getting to get everyone involved and interested in coming and saying, I want to have my genome profile, I want to be part of that.
Thank you very much, Isabel. We know that data drives decisions, and I wish you all the best as you get to this network of networks through the Terry Fox Research Institute. Natalie?
Thank you, Kathy.
Wonderful. Thank you, Kathy. Isabel, you touched a little bit upon it, and you talked about the Marathon of Hope Cancer Center Network's Gold Cohort. Can you explain what that is in a little bit more detail and why it's important?
Absolutely. What we are doing here is something unique that hasn't been done before. So this will be like the biggest data set that has been created in the country. We will have the objective, as I mentioned earlier, is to have 15,000 genomes by 2026. And we are right now over the 4,000. What that means is that we have information of the genomic profile of a tumor, and we also are collecting the clinical data associated to that patient. So we are also understanding how a particular tumor responded in a particular patient, having their clinical history and having the treatment history, etc. So all of that environment of that tumor. So it's a very important information to have, something that has not been done before, and we are moving that direction in creating this huge resource for the country.
That's amazing. And how exactly does the MOHCCN choose what cases get entered into the Gold Cohort?
Yeah, that's a very important question, Natalie. How it works right now, and I touched on this a little bit earlier, is the network is structured in these regional consortia. So that's how it originally was formed. We have a BC consortium, we have a Princess Margaret consortium in Ontario and expanding. We have the Marathon of Hope Quebec, we have the Atlantic and the Prairies. So these are our 5 consortia. How they are structured is their oncologists and their institution that are members of this network will recommend and will project what and how many number of cases they can generate in a given year. So how the network was structured in the beginning is with retrospective cases. What does it mean is cases that were biobanked and samples that were already let's say in storage and consented through for using in research. So that was a way for us to get started and to ramp up quickly. Now the network is moving in the last year and beyond. What we want to achieve is to move more in the prospective side, meaning that now we have patients and studies that are actually active in clinical trials and are actively going through the disease and battling cancer. So we are enrolling more and more patients in this network that are present during this disease, and also we are working towards one day having patients that can say, I want my genome profile, I want to be part of this, and enabling that to happen in a more real-time, let's say, manner. But as of right now, it really works through the oncologists, and they decide which are the cohorts that we call the projects and what are the cases that they can include.
Well, that was a great segue actually into the next question that I had for you is there any way for myself or any other patient to get their data into the gold cohort?
Absolutely. I think that's really the goal that we want to achieve, is to get there. And it is sort of happening. You can definitely, as a patient, go to your oncologist, talk about the Marathon of Hope, and be able to be referred somehow to be part of the program. So that can happen. But we are having active conversations right now to make that more in a stream way. And it comes with what we were touching earlier on more communication and awareness. It's about just not talking to your oncologist, but talk to your neighbor and talk to your friends about this initiative and starting to create more awareness. And the idea is that this initiative one day will actually change the healthcare system and will change how we are treating patients, and in a more tailored and personalized way. And for that, I think it's a matter of just the awareness, and creating the tools and making changes in the policymakers. And I think all that is just coming. It's exciting times. But right now, what we are is generating, let's say, the tool and creating that proof of principle for tomorrow.
That's wonderful. So what I'm hearing, I think, is that eventually, but I want to confirm this with you, that eventually oncologists, doctors, and any other clinicians that we as patients deal with will be able to access the MOHCCN data so that they can then use it to help make treatment decisions for the patient and help them come to a decision. Is that accurate?
That's accurate, Natalie. I think what we are today, as I mentioned, is in generating the tool and creating that proof of principle to convince government that this is how we need to establish in the healthcare system for our cancer patients. And that is the future. The future will be that you will get into clinic and your oncologist will be able to sequence your tumor, compare it to these research in the Marathon of Hope Cancer Centers Network, and choose the best therapy for you.
Wow. Well, I know that for me, this has been really enlightening, and I'm sure for Kathy as well, and hopefully to all of our viewers. But before we end, I'm hoping I can sneak in one little last question for you, Isabel. Could you please tell us how patients can support the Marathon of Hope network today?
Absolutely. I think it's very linked to our last point that we were discussing, Natalie. First of all, thank both of you, because you are part of this patient working group, part of the network. And this is remarkable, and this is how we are making a difference. We need your perspective and your voices into the generation of how the network should be today, but also where the network will be tomorrow. So just having the patients' voices to shape that and to be part of the initiative, I think it's super important, and that's what we do with both of you and the rest of the patient working group. And I think it's that potential to contribute. And then a bit of what I was mentioning earlier is telling the story, is talking to your oncologist about Marathon of Hope, is asking the question, is coming to our website and learn more about it. And also there will be opportunities to, and we have in our website, the opportunity to join this network in joining the patient working group as well. So that is what the big value that the patients can bring.
Excellent.
Thank you both, Natalie and Isabel. This has just been a fascinating conversation. It seems like a good place that we should wrap up for today, don't you think, Natalie?
Yeah, I think this has been fantastic.
Thank you very much for your time, Isabel. And I look forward to continuing this conversation with everyone. If there's any key takeaway I would find, it's that we are all working better together.
Absolutely. Thank you both.
Thank you.